with two experts to talk about living well with advanced lung cancer. And our theme continues to be that care should not wait. We have with us Dr. Ravi Thippeswamy, who is consultant medical oncologist and hemato-oncologist at HCG Hospital, Bengaluru. We also have with us Dr. Sai Vivek, a consultant medical oncologist at Sri Shankara Cancer Hospital and Research Center in Bangalore. As most of you who are watching this will be aware that lung cancer is one of the common cancers in India. It's among the top 4 or 5 cancers, and it actually leads to a fairly high degree of mortality among the cancers, largely because it's diagnosed late and up till a few years back, there were not too many good treatment options for advanced lung cancer, but that's changing. And there is now more and more treatments available. So it is important that you don't just look at the older experiences that you've heard of and, acknowledge that there are newer options available and explore treatment options. For those of you who are not aware, Patients Engage is an online platform for patients dealing with chronic diseases and their family caregivers to share personal experiences, learn from each other, but also learn from the information we put out in order to make decision-making easier. And the main objective of this is for you to also know that you're not in this alone. There are other people who've been through similar journeys and who are available to help. You will find a whole bunch of our content which we have created over the years on a wide range of topics, and here's just a sample, but really patients and survivors are at the center of our objective. Is everything is driven based on what experiences patients have and what they want to understand and what they want to hear. As this has been part of a series, so we had done the first part of this series on Wednesday earlier this week, and you can find the recording on our YouTube channel as well as our Facebook page, where we had spoken to Dr. Sushil Mandania and Dr. Jay Dadania on signs, symptoms, and risks of lung cancer. Today, we are talking of subsequently the treatment options available, as well as how do you manage living with advanced lung cancer. I've already introduced our panelists today. We have, as I said, Dr. Ravi and Dr. Vivek, and I'm Aparna Mittal. I'm the founder of Patients Engage. This session is supported by Pfizer. The content in this video is meant for information and awareness purpose only. It does not substitute medical advice. So please do consult your doctor based on the information that you hear in this conversation. The views expressed in this video are of the speaker, and it may not be endorsed either by Pfizer or by the platform Patients Engage. And if you are watching this on Zoom, Facebook, or YouTube, please do put in your questions and we will try and address them as much as possible. If not now, then subsequently. And if you miss asking it when we are live, you can email to editor@patientsengage.com or message us on any of our social media channels. So let's get started. We have a lot of questions to go through. Thank you, Dr. Vivek and Dr. Ravi, for joining us today. And I know it's a Saturday evening. You've taken time out of your personal, time off. So let's start, Dr. Vivek, with what is lung cancer and at what stage is it typically diagnosed?
So any malignant tumor arising from the lung is termed as lung cancer. Typically, there are two main varieties of cancer which arise from that. One is non-small cell lung cancer. Other one is small cell lung cancer. In non-small cell lung cancer, again, it's divided into two different varieties, adeno and squamous. So this is the broad overview of what is lung cancer. Next, in Western countries, only 25% of the people currently are diagnosed in advanced cancer. But in India, it's just the reverse. Almost around 70 to 75% of our population gets diagnosed with lung cancer in an advanced stage.
Right. One of the questions we had, Dr. Ravi, was, can lung cancer be a secondary lung cancer or a tertiary lung cancer? And is that then considered lung cancer or it's not considered lung cancer? Dr. Ravi?
Yes, ma'am. Basically, lung cancer means it is primarily arising from the lung. That's what
Right.
we mean lung cancer. Other cancers, what happens is, say some cancers will be there where they spread to lungs. So that we call it as metastasis. That we treat based on from where the primary has arisen. Suppose
Right.
if the primary is in the breast and it has gone to the lung, it is still called breast cancer with metastasis to the lung and not lung cancer.
Right. Thank you. And so, in this discussion, we will focus on where the primary is in the lung and not the other where it's, metastasis to the lung. So, Dr. Vivek, what is the typical treatment for advanced lung cancer, assuming that it's been diagnosed at a late stage of stage 3 or 4?
So for any lung cancer, currently there are 3 treatment options are present. One being the conventional chemotherapy. This has been the treatment for the last 30 to 40 years. People have been receiving it, and a lot of myths are there about it, which should be cleared at a later date. But the other 2 newer options are targeted therapy, and the last option is immunotherapy.
Okay. Dr. Ravi, do these treatments depend on whether there's a genetic mutation or no genetic mutation? How does that play into the treatment options?
Yes, madam. Now, earlier, say suppose 15, 20 years back when we used to see lung cancer, it was mainly based on only the biopsy, what type it is, whether it is a squamous or adeno or small cell, and then based on chemotherapy. Chemotherapy were general medicines.
Right.
But nowadays, in the last 8 to 10 years, there was so much advances that lung cancer itself is divided into various subtypes. Nowadays, the main focus is not on chemotherapy. So we are looking for some new targets, genetic mutations present, so that when we give this targeted treatment, one thing is the outcome, survival, all those things will improve. The other thing is the toxicity part. The toxicity will be very less, unlike chemotherapy. So by doing this, that is identifying the subtype of lung cancer, what target we are looking, and by giving targeted treatment, nowadays lung cancer is something like a chronic disease. It's something like diabetes is how we are managing.
Right, right. Dr. Vivek, anything else that you want to add to that?
That was, I think, very well put by Dr. Ravi. And what we need to know is more commonly, these genetic mutations are present in younger population, women, non-smokers. So those are the people who can just go on a pill like what we use for diabetes and hypertension and then have a good quality of life and extended survival. Next, for the smokers, usually, again, we go back to chemotherapy and immunotherapy. So immunotherapy, again, a lot of doubts about it in the society. Immunotherapy is basically, again, an IV injection given over a couple of hours. So what really happens is the cancer, being the smart cookie it is, it secretes or it has more of some decoy proteins which prevent our own body's immunity from detecting it and fighting it. So with our therapy, we are just attacking those decoys. So you wake up your own body's immunity and start encouraging it to fight the cancer. And this doesn't work in everybody too. So we again do a test to see what are the levels of these decoy proteins and then administer immunotherapy as an option.
Right. Okay. And Dr. Ravi, do patients kind of go into, I know you alluded that it's like diabetes. So that means what, these patients don't go into remission and it continues to be a kind of chronic condition? How does that?
Yeah, true, madam. So majority what we see, initial focus, early lung cancers, as we have discussed, the percentage is very small. In them, the chances of cure is very good, especially stage 1 and stage 2. Stage 3, stage 4, the most common stages what we see, about 70 to 80%. They are treated like any chronic disease. Whenever we diagnose, we treat them. It's a multimodality treatment. We involve the radiotherapy, surgeons, other supportive care groups. And once we administer, the patients do well for initial, say 1 year, 1.5 year. And again, the cancer may increase or progress. We may change the treatment. So every 3 months, we will be assessing them, see that the disease is under control, their quality of life is good. And by doing this, we are prolonging their lifespan and quality of life.
Right. Thank you. And I know you said it's chronic, but some patients have talked of the side effects of or toxicities associated with these treatment options. So Dr. Vivek, can you talk about what these are and how can patients and families actively manage these?
When we're talking about targeted therapy, again, we look for around 8 to 10 gene mutations which can be present in a person. Depending on which mutation is present, we tend to use that particular medicine to overcome the problem. So as a family of medicines, all of them do have some amount of fatigability, diarrhea. Most of them have certain skin issues like a rash which develops or really dry skin. And some of them can also cause loss of taste. And if at all somebody is having some other chronic problem, that can be exaggerated by some of them. These are the targeted medicines. Depending on which target, some more specific side effects will be there. Coming to immunotherapy, the major side effect again would be the problem with the hyperstimulated self-immune system. So the body would mistake other normal organs to be cancer and start attacking it. Depending on where it attacks it, from head to toe, you can have certain inflammation in that particular organ. So like keratitis in the eye, mouth mucositis, you can have diarrhea because of colitis, hepatitis, carditis for the heart. It depends on which area, but those infrequency to chemotherapy are way lesser and we don't see them often.
Right. And Dr. Ravi, what are the, what is the role of nutrition and exercise during this treatment, during, say, the targeted therapy or the immune therapy treatment?
It is very important. Nutrition and one more. What was the another point, madam? You wanted to discuss?
Nutrition and exercise.
Exercise, yeah. So both plays very important. As we have discussed, in managing patients, one thing is our treatment, the scientific way, what we give based on the stage, their general condition, we plan it. But from the patient point of view, from the family point of view, it is very important so that they understand, they cope, and it's a long journey. So everybody will be in the same page. Nutrition, why it is important is because it builds the immunity. Whenever we are giving any treatment, the patient should be able to sustain the treatment. So if they take good amount of nutrition, good proteins, their immunity will be good. The tolerance to the treatment will be good. The breaks because of side effects will be less. So ultimately, it will improve the long-term outcome. Similarly, exercise. Nowadays, this exercise, meditation, they have come up in a big way. There are a lot of even scientific literature supporting this exercise and meditation, suggesting that they will improve our immunity. They will stimulate our good cells in the body so that they itself will fight against the cancer cells. So both play a very important and crucial role.
Right, right. Thank you, Dr. Ravi. Dr. Vivek, what is the follow-up routine that is typically, expected of patients? And this becomes even more important because in India, often patients are traveling from, a smaller town to a bigger town for treatment and so on.
So for the targeted pills, the targeted therapy, which are pills mainly, we tend to closely observe them almost twice in a month for the first 2 to 3 months, just to pick up on those early side effects and modify the dose as and when required. But once we are past the 2 months barrier, then we start calling them only once in a couple of months or once in 3 months. So once we are confident that this person is tolerating it, follow-up can be much longer in duration.
Right. And typically how long, kind of is, because I think there are multiple generations of these targeted therapies as well, right? So do patients need to change these treatments over a period of time, or they continue with that single treatment for long periods of time? How does that change? Dr. Ravi? Okay, go ahead, Dr. Vivek first. No, it's okay.
Yeah,
go ahead.
so we tend to continue the medicine as long as it is working. There are only two reasons why we discontinue a medicine or think of a new medicine. One being intolerable side effects. Two being the disease is progressing.
Right. And when you say disease is progressing, how do you monitor that? Okay, Dr. Ravi?
Yeah. Usually, as Dr. Vivek told, the initial 2-3 months are very important, whether you start the targeted therapy or chemotherapy or immunotherapy. Once we know that the patient is tolerating well, in 2-3 weeks only, we will see that the signs and symptoms have improved. Their cough has reduced, the pain has reduced. So we will come to know by last that the patient is responding. And generally what we do some evaluation periodically. One is the regular blood tests, whether the patient is having any side effects in terms of anemia or low platelets, that we will support. The other thing is regarding the disease status. For disease status, we do evaluation in terms of scans, usually a CT scan or nowadays PET scan. That's how we follow. And once we know that the patient is doing well in the initial 1 or 2 scans, then we relax a little bit the number of times we do the scan. If the patient is asymptomatic, we may do it once in 6 months or later, based on basically the symptoms and how we find clinically whether the patient is doing.
Right. And Dr. Vivek, are patients able to go back to their hometowns and keep taking their pills, or do they need to? And of course, they'll come back for the follow-ups, but they can go back to their hometowns and keep taking their medication, right?
Yes, madam. So that's where there is a drastic change in the management of lung cancer. They're never admitted. It's as simple as that. So they come on OPD basis, get diagnosed. We find out what stage it is and what subtype it is. And then once we start the pill, then unless they're really sick or having a lot of symptoms, they're given the pill and sent home, asked to come back after a couple of weeks for the first follow-up. So that's where it has really changed in the last couple of decades.
Right. And Dr. Ravi, what are the long-term side effects that, or toxicities that, I know we talked of the immediate side effects, but are there any long-term effects that a patient should be aware of and keep monitoring?
Yeah. Generally in lung cancer nowadays, with a good amount of supportive care, we don't see much of these long-term toxicities because the drugs used are generally advanced nowadays, targeted medicines. So these acute side effects, once they subside, rarely they will go into long-term complications. But still, a small percentage may develop some cardiac issues or some endocrine dysfunctions. So periodically we will be checking their thyroid tests, the cardiac tests. So that's how we follow it. But if you ask about 2 decades before in terms of toxicity, and now it is very less.
Right. And, because I think Dr. Vivek, you said that younger patients are also getting it. What is the effect of the treatment on fertility and sexual health?
Chemotherapy, definitely, depending on the molecule used, can affect fertility, but not not a great disturbance in the regular sexual activity. No, but fertility definitely if it is chemotherapy. But as we go on along to targeted therapy and immunotherapy, even that is not there. So they can actually live a normal life. Nothing should change compared to what it was 5 to 6 months back, and their symptoms will gradually come down.
Right. And in terms of one of the issues that because it is seen as genetic, can you also explain, Dr. Ravi, the difference between kind of the genetic mutation versus hereditary? Because sometimes they think that all family members are now at risk, etc. So, and that in an Indian context has a lot of consequences. So, can you explain the difference, and also do you recommend genetic testing for the family members to understand their risks?
Yeah, lung cancer is one disease where the genetics, that is especially hereditary component, is very less. Majority, say 95% of the lung cancers are non-hereditary. Rarely less than 5% are hereditary. So one thing what we can assure the family members is it is not an hereditary cancer by large.
Right.
And
Right.
generally what we advise is, since these are all most of the time related to habits, so that is one thing what we should counsel the patient and other family members, caregivers, so that at least they can quit if some habits are there, so that they won't get into these problems. That is other thing. But
So when you say
otherwise,
habits, you mean smoking?
smoking, tobacco. So still in India, as compared to Western, this one still this tobacco plays a very important role in lung cancer.
Right.
So rather than hereditary, I think we should concentrate more on the lifestyle changes, which is very important in management.
Right. Right. And in terms of the genetic mutation, because again, for a lay person, that they see as genetic. So
Yeah. So genetic mutations in lung cancer are basically these are mutations in the cancer itself, not hereditary. So they are not transmitted by a mother to a child. Whenever
Right.
a patient develops cancer, we see mutations, and by analyzing these mutations, we develop drugs. So these are called genetic mutations, but these are not hereditary mutations.
Right. Right. Um, Dr. Vivek, any thoughts on, how, so I think the point is that lung cancer survivors, even though it is, as you said, there is now hope and there is more treatment options available, but it is emotionally challenging, and, not just for the survivor, but also for the family. So what are the kind of emotional and psychological needs that should be addressed of lung cancer survivors and their families?
So the major fear, both that is there in both the patient and the caregiver's mind, is the fear of death. So in India, and rather in any place, once you utter the word cancer, death is one thing that comes into their mind. So what is going to happen to their family, and who's going to take care of it, and how are their kids going to make it in the future? So first thing that needs to be addressed is they need to be counseled that this is the particular cancer you're having and this is the stage, and with the available treatment options, you're not at any immediate risk of death. So that can be managed with simple medicines. So they tend to calm down. Next, the caretakers also need to be counseled. So a psychiatric and or a psychological counseling for every cancer patient needs to be addressed at the time of diagnosis and at a regular interval, so that they do not slip into depression, and that could adversely affect their compliance to treatment and even some side effects.
Right, right. Dr. Ravi, any examples of patients who've had, and you can anonymize them, but based on your experience of managing patients, what are some of the better examples? What are the lessons that can be shared with the audience?
Yes, madam. There are quite a lot, but generally, I can still remember a few patients where initially we started with chemotherapy. They did well for say few months, like 9 to 12 months, and they progressed. This was, I'm talking about 12-15 years back. At that time, the treatment was again give some different chemotherapy, and then it will go on, and toxicities were very high. Now, what we are doing is, whenever a patient is progressing, we do something called these genetic tests, and invariably about 1 in 3 will have some or the other genetic mutation. So we have identified these genetic mutations, and we just put on pills. The patient who did say well for about 9 months with the chemotherapy, with that simple pill, they do well for another 2 years, 3 years. Then again we change the pill. So that is one say scenario what we have seen in multiple number of patients. The quality of life is so good that they do their regular work. and if they socialize, and even their friends, their family members, they say that now they are not looking like patients. So that's the recent advances and the quality of life and newer things which are coming, which I want to share. And I want to assure patients that now, as Dr. Vivek told, it's a multidisciplinary management. The word cancer should not threaten the patient or family. You should approach an appropriate treatment group, treatment hospitals, and you will be taken care.
Right, right. Dr. Vivek, your experience with patients, if you would like to share a couple of examples.
Yes, madam. Similarly to what Dr. Ravi said, yes, initially we used to use a lot of chemotherapy, and patients used to come back like almost once in a couple of weeks or 3 weeks with vomiting or diarrhea, severe fatigability, loss of taste. And that used to really affect their mental state. They used to start giving up. They used to say, I don't want to go through this. What kind of quality of life is this? Whatever the benefit is, I'm not going to see it now. So now I'm really suffering. And even the family tends to give up on the patient, not give up on the patient, give up on the treatment rather. But nowadays, even they are surprised. They ask us 2 to 3 times, is this pill enough? Is it better than chemotherapy? Because chemotherapy has been drilled into people's heads that is the treatment.
Synonymous with cancer treatment.
Exactly. Yeah. And everybody thinks chemotherapy is painful and multiple other things. Even chemotherapy has advanced in the last couple of decades. Probably not new drugs, but the drugs we use to prevent side effects have improved in the last 10 to 20 years. But targeted therapy, again, we have seen people that after finishing chemotherapy, we would have gotten their results of their genetic testing, and then we would have put them on a pill. For a good 2 to 3 years, they do well. And then again, even if cancer increases, we tend to do the genetic testing again. And then based on what is the situation, they can go on another pill. So it's like changing pills for diabetes. Right. So we have a lot of people who've been doing that for the last few years. And then they travel, they go and visit their family in the US, stay there for 6 months and come back. Like any other person of their age, they're living a pretty normal life. This has to go into the public, and they need to start realizing that we are progressing scientifically in terms of cancer care.
Right, right. And I think from our perspective also, to add to that, we have spoken to patients recently, and you can find their videos on and most of them, as both Dr. Ravi and Dr. Vivek said, they continue to work professionally as well. And live fairly, they travel, they continue to work in the workplaces. So they do manage to live fairly productive and, good quality of life. I think one issue that I would want that comes back often is the financial aspect of the treatment, right? So Dr. Ravi, anything that you'd like to mention on that front, because these are expensive treatments. So how, what can patients do to manage this, and how do you?
Yeah. Yes, madam. See, some treatments are really expensive, especially when we don't have the generic options. But nowadays, what has happened is majority, say 70 to 80% of the time, the generics medicines are available with similar efficacy. So now the cost initially, what we used to say about ₹1 lakh per month, it is available at 10,000 rupees per month or even less. So that is one thing what has made the treatment option very easy. Still, a small percentage of drugs are there which where the generics are not there. I think from the government side and from the pharma company side, they are working together, and they will make sure that probably in another say a couple of years the drugs cost will come down. So I think things are progressing nowadays. There are options available. Suppose a family is not able to afford one particular drug, we have an alternative option where generics are available, and we'll make sure that they get an appropriate treatment. Though it is not inferior, but an appropriate and good treatment. So the options are plenty now. So we need not think too much about if say one is not available, that's the end. Other thing is there are a lot of social groups. So in every hospital, there are a lot of social groups, financial organizations, NGOs. They are willing to donate, willing to help. and we'll make sure that the patients are connected to an appropriate group and they get the appropriate treatment.
Right, right. Dr. Vivek, any final words to our audience?
I think in terms of lung cancer, what we can take home is in our country, we need to double the rates of diagnosis at earlier stages or later stages. We need to bring that 75% of advanced cancer diagnosis to at least 50-50 in the near future. And that can happen only with early diagnosis. And awareness plays a huge role in that. So a lot of people, if they're non-smokers, they tend to neglect their chronic cough or shortness of breath, saying, I've never smoked a cigarette. I might not get cancer, but that proportion is on the rise. So any symptom like cough, shortness of breath, breathlessness, which is lasting for more than 2 weeks and not responding to the treatment given by the general physician, should be evaluated with an imaging and then followed up with an oncologist if necessary. That's the only way we are going to beat this. And people who have actually smoked for, let's say, 20 to 30 years, multiple packs per day, they can go on a schedule of screening known as low-dose CT screening once in a year from the age of 45 to 50 or all the way up to 75 to 80. That can be used as a form of screening to detect them at the earlier stage. Once we are able to do this, the survival rates are going to improve.
Right, right. Thank you so much. Dr. Ravi, final words from you.
Yes,
finally
Niyama,
got
yeah.
you on video.
Yeah, doctor. Yeah. Thank you. As I told, I think not only lung cancer, all cancers are treatable presently. It's a multidisciplinary management. A lot of cancer hospitals have come up in India, even in district places, two-tier cities. Now, we should identify an appropriate treating hospital, treating group of doctors. And I think nowadays, a lot of ways are there so that they will get appropriate treatment. So my take-home message or what patients and families should take home is once cancer is diagnosed, so go to an appropriate cancer specialist and make sure that a proper treatment group is there and you will be taken care.
Right. Thank you. Thank you so much, Dr. Ravi and Dr. Vivek. I think the points have been very strongly made that lung cancer is treatable. And the key important message still is to get to an early diagnosis. And as you know, Dr. Vivek said that I think it's a small percentage of barely 20% that gets diagnosed in the early stages, and we need to change that. And for that, as people, we need to be aware of our own risk factors and not ignore symptoms for long periods of time. So, do kind of take a proactive action on that and understand why your cough continues. And also for those who are already going through treatment, keep the faith. As both doctors have said, there are good treatment options. So just because you've been diagnosed with lung cancer, you don't need to think that it's the end of the world. People are living for more than 5 years, 10 years with lung cancer and continuing treatment. And we have examples of patients who've done that. So if you need to speak to any of them, please do reach out. And thank you so much once again, Dr. Ravi and Dr. Vivek, for taking the time, and to our audience for listening into this. Thank you once again.